Virtual care, it's just exploded, right? The promise is huge. We can reach more patients more easily than ever before. But if you're a provider, that promise probably comes with a whole lot of questions. Like, can I see my patient if they're on vacation one state over? Or does my hospital's approval cover this? Do I have to reapply with every single insurance company? We are going to cut through all that noise and give you a clear, straightforward guide to telehealth credentialing. So, here is our game plan. We're going to start with the one simple question that every provider is asking. Then, we'll dive into the biggest legal hurdle out there, the invisible state line. After that, we'll navigate the paperwork maze of hospitals and insurance. I'll give you a practical checklist you can actually use, and then we'll wrap up by looking at what's next. All right, let's just dive right in with the big one, the question that really kicks this whole thing off for any provider thinking about virtual care. Do I really need a whole new set of credentials just to see a patient on a screen? I mean, you'd think the answer would be a simple yes or no, right? Well, the short answer is no, you don't. But come on, this is healthcare. You knew it wasn't going to be that easy. The long answer? That's where things get a bit more complicated. And it all boils down to two things: where your patient is and who's footing the bill. So first, let's just get on the same page. When we say credentialing, what are we even talking about? Think of it like the ultimate background check for a medical professional. It's just the process where hospitals and insurance companies verify that your education, your training, your licenses, that it's all legit. The key thing to get here is that for telehealth, it's not about getting a brand new type of credential. It's all about making sure the credentials you already have are valid for each and every virtual visit. And that whole idea of validity leads us directly to the single biggest rule in all of telehealth. Seriously, if you remember one thing from this explainer, make it this: your patient's location is everything. Now, this is where the logic can feel a little backwards. It literally does not matter where you are. You could be in your office, at home on your laptop, anywhere. What matters, the only thing that matters legally, is the physical location of your patient during that call. So if you're licensed in California, but your patient happens to be in Arizona for the appointment, you legally need an Arizona license to treat them. The patient's location calls all the shots. For years, this rule was just a massive headache, a huge roadblock. It forced doctors to go through this ridiculously slow, painful process of getting a full license in every single state. But thankfully, there's a solution now. It's called the Interstate Medical Licensure Compact, or IMLC. The best way to think of it is like an express lane for medical licenses. It's an agreement that helps qualified doctors get licensed in other member states way, way faster. And look, this isn't some tiny little pilot program. We're talking more than 40 states and territories are part of this compact now. That is a huge deal. It's a massive shift that shows the system is finally starting to adapt and make it easier for doctors to care for patients no matter where they are. Okay, so you've got the right state licenses. You're all good to go, right? Well, not quite. Now you have to deal with the next layer of gatekeepers: the hospitals, the insurance companies, and the government payers. Welcome to the paperwork maze. For hospitals, there's a potential shortcut you should know about called credentialing by proxy. What this means is, if you're already fully vetted and approved at Hospital A, a partner, Hospital B, can just accept that paperwork instead of making you start from scratch. I mean, this can save you months of work. The catch? Not every hospital system does it, so you've got to ask. You have to find out if they'll accept your primary credentials or if you're stuck filling out yet another full application. All right, let's talk about getting paid. With private insurance, if you're already in network with them, you usually don't need a separate credential just for telehealth. But, and it's a big but, you absolutely have to check your contract. Dig into that fine print. Some of them have sneaky little clauses about which states are covered for virtual care, or maybe they require some new telehealth-specific training. And you can bet they will always verify that you're licensed where your patient is. Government payers, of course, have their own set of rules. Medicare is actually the simpler one. If you're a Medicare provider, you're good to go for telehealth. The main headache there is just keeping up with their constantly changing coverage rules. Medicaid, on the other hand, that's the complicated one. Because it's run by each state, you have to enroll in every single state's Medicaid program where you plan on seeing patients. So why is getting all of this right so critical? Well, look at these numbers. Each one of those applications, for a new state license, for a hospital, for a Medicaid program, can take anywhere from 3 to 6 months to process. Now, just imagine doing that for multiple states and multiple payers. This administrative burden isn't just a hassle. It can become a real barrier to providing care. Okay, that was a lot of problems. So let's shift gears and talk about the solution. Here is a straightforward, practical checklist to help you get started with telehealth the right way. Let's walk through this. First, know your baseline. Confirm exactly which state licenses you currently hold. Second, be strategic. See if the IMLC can be your fast track for any new licenses you need. Third, prevent surprises. Call your payers before you start, not after a claim gets denied. Fourth, get the official okay from your hospital's medical staff office. Fifth, create a paper trail. Keep organized digital files of every single license and application. And finally, stay curious, because the one guarantee in all of this is that the rules will keep changing. And that last point, that the rules are always changing, brings us to our final question. Where is all of this heading? What does the future of virtual care regulation even look like? Here's the good news, everyone, including policymakers, knows that the current system is a confusing patchwork. The goal is to move from that complicated map to something much simpler. There are active, ongoing conversations happening right now about creating more uniform federal laws to streamline telehealth for everyone, making it easier to provide care without sacrificing patient safety. And that really brings us to the bottom line. This quote says it all. Telehealth offers these incredible opportunities, but it requires careful, proactive attention to the rules. Getting the details right from the start isn't just about compliance. It's about protecting yourself, your practice, and your patients. So we'll end with this thought. Right now, technology is absolutely sprinting ahead of policy. The very lines on the map that have defined medicine for a century are starting to blur. So the question we're all left with is, how do we redraw that map for the future of care?